We have had 20 new cases overnight. The one positive to take out of those 20 cases is every single one of those is from a known source. Whilst I remain incredibly concerned, that is one positive takeout, that all the cases now are from known sources, which means that people are taking advice, and we need them to continue to do that. Please make sure, if you've been told to isolate at home, that you spend 14 days at home. Even if your test comes back negative, if you've been told to stay home 14 days, you have to stay home 14 days. You may very well develop the disease and become contagious on day 3 or 4 or 5 as opposed to day 1 or 2, and it's so important to have everybody stay home when they're meant to be at home. And I want to thank record numbers of people who are coming forward to getting tested. We had over 20,000 people on a Sunday and a Saturday come forward to get tested. That is just amazing, and we're deeply grateful for that. But we also know that our state continues to be on extremely high alert, but also our state continues to be at a critical point. We have the opportunity to isolate the cases that we have, to clamp down and to make sure that we reduce the incidence of the virus spreading. We have that chance still in New South Wales. Unfortunately, other places don't have that opportunity. We have the opportunity, whilst we have to modify our behaviour and whilst we should think about our activity, we have the ability here in New South Wales to keep moving forward whilst we're controlling the spread, but it's up to all of us. And can I say very, very strongly, please heed the health advice. The next few weeks are critical. Please avoid large crowds. Please think twice about going into any place which has crowds in it, even when you're socially distancing. And as the advice has been provided in New South Wales, if you cannot guarantee social distancing where you're going, if you cannot guarantee that people will around you respect that social distancing, you must consider wearing a mask. But so long as you can maintain social distancing, you can go about your day, but please minimise what we call non-essential travel. Don't go to locations where you know there's going to be crowds. Don't do those things that you might do when it's not a pandemic. We are in a pandemic, and the next few weeks are critical. If we get through the next few weeks and the next month, we will have confidence that we can keep moving forward in New South Wales. But as you know, we're dealing with a number of factors here. We're dealing with potential seeding from Victoria. We're dealing with the fact that people were more mobile during the school holidays, and we're dealing with the fact that restrictions were considerably eased. So those three things make this a very critical period in our state, especially as we try and control or at least identify all of the seeding that may have occurred from Victoria. And that's why it's a really critical time. So now I'll ask Minister Mitchell to give a quick update on schools. Mr Henskins will say a few words on his community, and then Dr Chant will give us a detailed health report. Thank you.
Thank you, Premier. Good morning, everybody. So very excited to be back for the beginning of Term 3. We'll have students coming into the classrooms from tomorrow, and at 5 of our schools across the state, including here at Ku-ring-gai High School, coming into brand new facilities. Here we've got 15 new classrooms, a fantastic new performing arts centre, $15 million invested right here in this local community. And as the Premier said, that brings our total of school projects so far this year to 42. That matches what we did last year. And we've got more than a dozen to roll out throughout Term 3 and into Term 4 as well. So really exciting to see that significant infrastructure investment taking place right here in New South Wales. Of course, we're happy and excited to have our students back for Term 3. Certainly, we are still saying to parents that if your children are unwell, you do need to keep them at home. We don't want kids coming in who might have a mild cold or a sniffle. It's very important that we continue to be vigilant, that we follow the health advice, and that any students or staff who are unwell need to stay at home. And we'll continue to have those extra measures in place in our school communities that we brought in last term. The additional hand sanitisers and hygiene products, the additional cleaning throughout the day. We know that our schools are well prepared to manage throughout this pandemic. We saw that in action in Term 2. I know that that will be the case in Term 3. We are ready to respond, and I just want to thank all of our parents and our school communities for the amazing job that they did during Term 2. I hope they all enjoyed the break, and excited to have everybody back for Term 3.
So in terms of the update, there were 20 new cases of COVID were diagnosed in the 24 hours to 8 p.m. last night, bringing the total number of cases to 3,399. There were 21,167 tests undertaken, and thank you very much to the community for coming forward. There's currently 96 people being treated by New South Wales Health, and 2 are in intensive care. 1 is requiring a ventilator. I'd also like to highlight that one of those cases in intensive care is actually a person in their 30s. And I think it's always important to highlight that, because often we tend to say this disease affects the elderly, and it does on average, but there still will be young people that are impacted, and it is a call out to everyone to take this COVID-19 very seriously. Of the 20 new cases, we have 3 people who are contacts of cases linked to the Crossroads hotel cluster. We have 8 people who are associated with the Thai Rock restaurant in Stockland Mall, Wetherill Park, including 4 who attended the restaurant and 4 close contacts. We have 4 people associated with the Batemans Bay Soldiers Club, including 2 diners, 1 staff member and a contact of a previously reported cases. We have 4 overseas travellers in hotel quarantine and 1 person who was infected whilst in Victoria and has been isolating since their arrival. I'd also like to highlight the importance of the isolation guidance for people returning back from Victoria. It is essential that people isolate for 14 days since they were in Victoria, and that's, as the Premier said, because that's the incubation period for the disease, and disease may turn up at any time during that period. So please watch for symptoms, however minimal, get tested, and please adhere to those self-isolation requirements. So the total number of cases associated with the Crossroads hotel cluster is 48, and this includes 14 who attended the hotel on the 3rd of July, 1 who attended on the 5th of July, and 33 who are linked to the cluster but did not attend the hotel. And I think this highlights again the way in which this disease can be so insidiously spread. Once you get a seeding event, you then can infect many, many other people. And can I thank the community again for coming forward. Their actions have allowed us to identify these cases, and I urge the community over the next 2 weeks, regardless, across the state, whether you're in southwestern Sydney or western Sydney or across the state, now is the time to come forward for testing. Even if you have minimal symptoms, it's incredibly important that we find and detect as many cases as we can to stop those chains of transmission. Thank you.
Questions?
Dr. Chan, can we just ask you for the Batemans Bay cluster? Do we know patient zero in that case? Do we know where it started? Is it connected with that Melbourne couple that went down from Fernell to...
So at this point in time, we don't know the source of the Batemans Bay cluster. We'll obviously use genome sequencing, but part of our investigation is actually looking at, as we've developed a bit better idea of where the case is acquired and the time sequence, we will now be going back the 14 days prior to that to look at who was at the restaurant at that time and whether we can find and detect another source for the infection. So our investigations are undergoing, but for that outbreak we're not clear on who was the original source, but we do have a better handle on the chains of transmission.
In terms of that investigation, have your tracers been able to make any link between the Thai Rock restaurant and the Crossroads Hotel? When you gave the numbers there, you did treat them as separate incidents. Has there been any connection established?
There's obviously ongoing investigations, and there are some tenuous links, but not sufficient for us to establish a connection at this time. Often we have to await results, further serology testing and other results to identify could we missed an intermediate person. And as I said, when we say missed it, it's not because of anything that's a failing, it's just the fact that this disease is such a mild disease that someone may not have been aware at the time, but we can do blood tests on them to see if they were infected, and that can help us piece together. But this is not the jigsaw puzzle sometimes has empty blank spaces, despite the best detective work that our case contactors undertake.
Doctor, do you have information about there was a junior football match on the weekend where a parent of one of the kids didn't actually attend, but he does have the virus? Do you have information about those kids having to isolate?
So if that person, I'd be happy to look into the circumstances, but the general situation is that if it's a contact of a case or a person with the virus, they are required to obviously self-isolate, and then if anyone is a close contact of that case, they are required to self-isolate for 14 days. So we need to look at the sequence, but clearly that is the requirements around cases and contacts.
With schools going back this week, is there any plan for inter-school activities which are due to start up again, music, sport? Is there any plans to reintroduce restrictions on that, or are they still scheduled?
We're working with Education Department, and it's been pleasing to see the strong COVID-safe practices. Obviously, we'll review and work collaboratively with education and adjust the advice as necessary. But at the moment, we're very confident in the social distancing and the hygiene measures that have been put in place. And we do urge parents at this time, as they're dropping off their children, again to adhere to the guidance from the schools around the kiss and drop sort of way of approaching that, and ensuring no congregation of adults outside the school premises.
Yesterday there was advice that came out about to consider wearing face masks in public with New South Wales Health. Why is that now necessary?
So New South Wales Health has been pretty consistent with the national advice, which is where you can't socially distance, face masks are prudent. The role of face masks is, we know that people are symptomatic. Before they get symptoms, they are infectious for approximately 48 hours. And so individuals may be actually infectious and out and about. And the idea of the face masks is that if people are occasionally coughing or sneezing, then they could be infecting others, and the face mask provides a shield. So the face mask in the end provides a defence more for other people than yourself. And in circumstances where you can't socially distance, New South Wales Health has consistently messaged that face masks are a reasonable action to take. But we wouldn't want to see face masks as a silver bullet. And it's important to say, I describe it as sort of the 4 lines of defence. We need social distance. First of all, don't go out and about when you're sick. Stay at home, get isolated and get tested. The second is very much around social distancing and adhering to social distancing, and also making decisions about how you move about so that you can maintain that social distancing. Hand hygiene's the third, and face masks are complementary. They are an adjunct, and an important adjunct, particularly in circumstances where you can't socially distance, or if you are unwell and are seeking health care, then certainly putting on a face mask at that time as you go and seek care, and immediately identifying that you have COVID symptoms when you attend that healthcare practice is essential.
But just in terms of just going to the supermarket or a shopping centre, should be any of us here be wearing a face mask?
I think it depends on your local supermarket. Depends on the time you shop and whether you can maintain that social distancing. Every supermarket, I'm just reflecting on my local ones. I've got a number of supermarkets that have got excellent social distancing. I wouldn't feel that I could maintain my 1.5 in all of the interactions. It's a personal choice, but we are saying that it is an important adjunct, and also our advice may even strengthen if we got evidence of broader community transmission. Obviously, in those settings, that's something that we'd more strongly encourage the use of face masks. But it's important that people all play a part, and where you can't socially distance, it is important that you consider using face masks.
Schools are very confined places. Should parents think about sending their kids to school with a face mask?
Look, again, it's a personal decision. The schools have put in lots of places where we maintain social distancing. We've never said that children can't transmit to each other, but children on average are not the drivers of infection, so that's a factor that parents need to weigh up. Also, the compliance issues with face masks. So one of the other things, if people are going to wear face masks, they need to have them affixed to your nose and mouth. There's no point if they're hanging off. They can actually pose a risk if you've coughed or sneezed into your face mask and then you discard them on surfaces. And so these are the practical considerations with face masks, and really it's a matter for parents. But at this point in time, we're not recommending that students are sent to school with face masks.
With 7.5 million residents in New South Wales, if we need to go down the path Victoria's gone down, how are we placed in terms of stockpiles and supply of masks?
We certainly have a large number of surgical masks, but as you've seen in Victoria, they've gone to recommend, where you can't use surgical masks, cloth masks. And again, cloth masks can stop droplets. They're not good with aerosols, but this virus is predominantly spread through that droplet route. But again, our advice is, we need a multi-pronged attack to this virus. We also know that it's not practical. Some of the settings where we've seen transmission occurring is often in eating or drinking venues, and the practicality of wearing masks in those settings. So mask wearing is an important adjunct, but it is not a silver bullet, and we need to make sure that we modify all our behaviours. It is a numbers game, and if young people are infected with COVID, a small number of them will actually have severe outcomes. We have great clinicians, and generally they have a good prognosis, but I think it is a warning that even young people can end up in intensive care with COVID-19.
Premier, the health minister last night announced significant changes with the Port of Victoria. At the other end of the state, in Queensland, there are still very long delays of people travelling between various towns between. Are you looking at maybe making adjustments to the border around this?
Well, in relation to the Queensland border, I mean, New South Wales has always had open borders with Queensland, and that's an issue for the Queensland government. But can I say that even though I've heard media comments from the Queensland government in the last 10 days on this issue, it's only this morning that I got a very short text from the Queensland Premier about the matter. And obviously we're happy to engage, but I'm happy to consider all options, except I do not believe at any stage that we should move the border. If anything, the border should be moved north. There is zero infection in northern New South Wales at this stage, and certainly we'll do the right thing by residents on both sides of the border. But I have no intention of changing things as yet. I'm unclear as to what the Queensland government's asking us to do because they've not communicated that yet. I've heard through the media that I'm receiving a letter, so I look forward to that letter.
Just on the outbreak in South Western Sydney and schools going back, are there any plans for adding extra precautions to their open?
Yeah. Well, certainly the health advice has been consistent about southwest Sydney and in broader communities, and that is for all of us to restrict anything that is non-essential for the next few weeks. So let's consider avoiding crowds, consider making sure, extra sure, that we keep our social distance, but also that the mildest symptom requires us to go get tested and stay home until otherwise advised. So it's really important for us to go that extra mile. I tend to be a cautious person, so I'm definitely going the extra mile, and I want others to consider that as well, because this is a time when it's very critical for our state. As I said earlier, we're dealing with 3 new factors. The most critical factor is that we don't know the extent of setting from Victoria. We know that a number of sources of cases in New South Wales are essentially from Victoria.
Sorry, are there any plans for schools in that area?
Oh, sorry. Well, obviously we'll rely on the health advice for that, but the health advice for southwest Sydney is avoid non-essential travel, make sure you get tested with the mildest of symptoms, and as Dr. Chance said, for parents to follow those instructions given by schools. Most schools, every school that I know of, prevents parents from even coming onto the campus and making sure children are dropped off outside, but also consider how your children are getting to school and how you're managing them when they are at school. And please, I don't want to hear of examples of people turning up to work when they've got symptoms. You shouldn't be at work if you've got symptoms. You shouldn't be interacting with others if you've got symptoms. That is a huge no-no, and we encourage everybody to also limit their behaviour or activity in the next few weeks, especially around large crowds, whether it's going about your daily business or whether it's hoping to socialise with others. Please limit your exposure and that of your family. The next few weeks are absolutely critical for New South Wales. Under the circumstances, we are holding the line. Under the circumstances, we're doing okay, but it hasn't reduced my level of stress or concern. In fact, I'm as stressed and as concerned as I was 10 days ago or 2 weeks ago, and I don't want us to go down a track where we see suddenly a doubling or tripling of cases. That is not good for New South Wales and not something we want to face. But we do have the chance to really get ahead of the virus, to control its spread, if all of us take those extra steps.
Okay, we'll just leave that there.